Every year, Dr. Stephen Miller leads a Rotary medical mission to Guatemala. Each year, 30-plus medical professionals take a week off from their normal routine to volunteer at a hospital in San Lucas, Toliman. The medical team is made up of members from across the U.S., many of whom have never worked together. By the first day of surgery, they perform like they've been working together for years. What follows is an overview of the week and how this diverse group of volunteers joined together to make it all happen.
So Monsignor Gregorio was the first founding priest of this particular mission out of Minnesota, and he lived 55 years here before he died. The hospital was built by many good-hearted Minnesota folks who built the hospital over 10 years. And it was meant to serve many people that would have medical crises on this very isolated part of Lake Atitlan who couldn't get the 2.5 or 3 hours up to the National Hospital. But it was empty when I got here. Literally, these buildings, these rooms were empty shells. The operating room was 4 concrete walls with not a piece of paper in it, not a light bulb. There was nothing there. It had no scrub sink, it had no air conditioning for temperature control, it had no tile walls. It was a rudimentary pre-operating room. So the Monsignor said, we need healthcare here. We have a black hole of healthcare. There's no medicine here. There's nobody to serve. So he trained a very bright young graduate of their own school here in San Lucas and sent them to medical school in Guatemala City. And he came back to serve his own people, Dr. Rafael Toon. Dr. Toon is my boss. And I can say this with pride easily. He's the best employer I've ever worked for in my medical career.
San Lucas Toliman is
San Lucas Toliman is a town that is on the west side of the country of Guatemala. At this time, the approximate population is of 35,000 inhabitants and is divided by 16 communities that are in the rural area. A little bit more than 50% of the population of the urban area, and the rest is in the rural area.
I had medical contacts, but the longer I lived here, the less medical contacts I had in the U.S. And wonderful friends like Dr. Steve Miller and many other medical associates of mine started sending other medical equipment. And every piece of furniture in this room, $6,000 medical chairs and surgical lights and pharmacies and x-ray boxes were all later brought down to open this clinic. We still have a wonderful network of doctors all over the country who look for things they know I need to run an orthopedic surgical program.
So it's really good that we were able to bring a team here once this doctor arrived, Dr. Bogle. We have been coming down here now. This is our 8th year coming to this hospital. And the whole skill that I feel that I've been given is to bring these people of many different skills and backgrounds together who have many of whom have never seen each other. And all of a sudden, within a few hours of meeting each other, we are working in a very complex environment doing very sophisticated orthopedic surgery, basically.
Whether they are treating patients or repairing medical equipment, the nurses, equipment technicians, translators, X-ray and anesthesia teams, along with the surgeons, are all pulling together to ensure a successful mission.
My name is Carl Kim and I'm a podiatric surgeon. This is my 9th mission trip. The best part of these trips is that screening day, seeing the patients come back. On the OR table, when we're done, we see the foot position and the correction we achieve, but man, when they come back, we get to see them and hear their story, and hear their parents tell us how grateful they are. It's very special. One special patient that we had is Esther. She came to us for the first time about 3 years ago, and that was my first mission trip here in Guatemala. I met her and her feet were both turned in and clubbed, and it was just amazing to watch her walk. It was hard to believe that she could walk. I think she was 7 years old at the time. To understand from her father explaining how that deformity has affected her life, it was pretty heart-wrenching. We corrected her one club foot the first year, and she came back to us last year and we corrected her other foot. So for the first time, immediately on the post-op scenario, she has 2 straight feet.
I'm Libby Weber, and I'm from Gillette Children's Specialty Healthcare in St. Paul, Minnesota. I'm in pediatric orthopedics. I treat children with congenital diseases of bones and muscles. My group decided to start incorporating level 1 trauma into their practice, and they asked me to come out and start that program.
Most of your surgeries here in Guatemala are helping the children. Are there any other surgeries that are special to you?
They all stand out. They just live in my heart, all of these patients, because I remember every single one of them, and I review the cases when I get home, and I'm constantly talking to Will about their follow-up, and we're exchanging emails and x-rays so that I can see how they're doing. The dinner that we had last night, I was speaking with one of the nurses through an interpreter, and she said that my friend Francisco was living in town and doing well and really wanted to see me, but he was a 40-year-old manual laborer. He was in Guatemala City with his daughter and got carjacked at gunpoint, and they wanted to take his car, which he had a problem with, but they wanted to also take his daughter, and he had a huge problem with that. So he got in a fight with the gunman and got shot. We spent a couple of years fixing him. We got the infection cleared the first year, and then we had to span him with an external fixation device the next year, and then we fixed him the year after that. And he's walking around doing his job. Daughter has a baby.
How would you compare working at this facility to the Gillette Children's facility?
It's challenging, and it's nerve-wracking, but I think that it really ups your game. First of all, it makes you go home and appreciate how great everyone has it, how great your life is, how great your patients' lives are. But it also makes you more of an innovator. You can't get stuck in a rut and you know, have to have the exact same suture anchor every time. It's not, you know, we're cutting screws because we don't have the right lengths, and we're doing ridiculous things down here. But it works, and it's healing these kids. So, yeah, it's fine.
So what started out as a foot and ankle focused surgery role, which is my training, has developed into a full body orthopedic, wonderful reconstructive program for children. And there's a great team of podiatrists and nurses and pediatric orthopedists, and they help us do major reconstructive surgery on all of the unmet health care that these poor children don't get. They can't afford surgery. Their parents can barely afford food. We look for those who have no options, and that's who we serve.
And our ultimate goal is 2. One is to serve these people and give them more opportunities. And the second thing that we're looking for when we come is, can we make these people self-sufficient? Are we going to develop this hospital and keep giving it equipment, training, help us work ourselves out of a job? And I think that's part of Rotary's motto, is the service we give has to be not just making an impact, but to be sustainable. For example, today we're waiting for our first large C-arm to come in. It has been purchased by the Bend, Oregon Rotary Club, and with the help of a Rotary Global Grant. That will change things because we can do bigger orthopedic surgery, which we haven't been able to do.
And on top of that, we've developed very wonderful relationships with Rotary. Starting with water, you always have to have clean water, and this hospital did not have clean water. They were taking dirty lake water. What a shame. A hospital was delivering dirty water to the people. Well, we put in a $22,000 SunSpring solar-powered rooftop water system, water filter, and I signed off it as president of the local Rotary Club on the lake here. They also brought in, to replace the World War II 1943 Picker X-ray machine that was illuminating half of San Lucas Toliman, a beautiful new digital Spanish X-ray machine, and a mobile fluoroscopy machine called a mini C-arm. And that was a $100,000 Rotary Global Grant. We're bringing in another specialty X-ray machine called a large C-arm. That's coming probably tomorrow, for more general orthopedic and full body use for all the other surgical groups that are here now. And we just bought a brand new truck that it was converted to an ambulance, and Rotary paid the $32,000 for that device. And that's a wonderful life-saving instrument that Rotary has purchased and put on the road. And I'm the one signing off on all these programs as the local Rotarian. I know what the need is. I go and do my professional begging at Rotary clubs up north, and then they supply the needed equipment through their international programs.
Entonces el problema ahí es siempre lograr encontrar los fondos.
My vision for this
la manera
charity
necesaria
hospital
para seguir
is to
progresando.
provide quality medical care for poor people of the area of Sololá and southwest Guatemala. We get financial support from the church's mission, and the church's mission has other projects like education and housing, and we're always competing for funding with those. But when education and construction have a clearer, more obvious ways of showing progress, for example, when a house is being built, you can see how it's being built and where the money is going. In the healthcare area, there is not a clear way of showing those results. For example, diabetes. Managing diabetes takes years before there is a change in the health of people with diabetes in the population. That creates a difficulty to get the money for that kind of program. It would be of great help if the people participating in the mission they could get more involved in our healthcare program, so they could understand a little better our needs within the program.
I don't have to think about insurance anymore. I don't have to think about any of those paperwork, horrible distractions in the US. I can come here and do real medicine for real people with no money in between, and we have no economic barrier. People can come here and have a $50,000 reconstructive surgery for nothing.